Good afternoon, ladies and gentlemen. My name is Dr. Ian Hosein. I'm in London in the United Kingdom, and it's the 23rd of March, and it's 6:15 p.m. I am the first Director of Infection Prevention Control appointed to the UK, and because of my experience in the field, many friends have asked me to say a few words about perhaps clarifying issues around hand hygiene and many other topics coming up now around coronavirus. In order to address the public, because of the amount of information out there. So by background, I brought alcohol gel into the United Kingdom in 1996 because of work I did trying to understand the link between human behavior and technology. What is it that prompts people to do something and not do something else? And that was the beginning of the work in hand washing that I did quite a number of years ago. For this video, there will be more to come. I want to talk about hand washing because of the background that I have, and social distancing, both of which are vital to defeat this virus. So let us pick up hand washing. It is effective. That's the first thing to know. It does work. The data shows it's work, and we have a long history of knowledge around hand washing. And the 20 seconds rule that the governments advocate is the right figure, or beyond. All I want to add is that it's a mechanical process. Soap and water does not kill the virus, but it will wash it off effectively. But what I would do is be quite vigorous in the way you wash your hands. Pay attention to in between the fingers and to the fingertips. Don't worry about the order. Just do it vigorously. And keep in mind, washing it off to defeat it. The second element of hand hygiene, so hand washing is the first element. The second element is the alcohol gel. It is also effective. Alcohol inactivates the virus. The gel is just a matrix. It's the alcohol that is active. And you can use it if you're walking about, you touch the environment. And having mentioned the environment, let me describe its importance. So this virus is a respiratory pathogen. It is human to human. It emerged from an animal, but it's now a human pathogen. You can only get it from another human being. However, human beings contaminate the environment. So you may get it via the respiratory tract directly by breathing in from somebody else, or they contaminate the environment. You then touch the environment and you touch your nose or your eyes. These are part of the respiratory tract. So the hand hygiene picks up the contamination bit that is direct. Just don't touch your face without your hands being clean. So for example, if you're going to eat, make sure you wash your hands beforehand. Now in terms of the other mechanisms, so mechanism one we just talked about is contact. The more critical one is of course breathing. You can breathe the virus directly in. People who are shedding it, they may not know they're shedding it because they feel well. And there is a certain distance of droplets that may fall from them or emerge from them. And that is why the government is talking about the 2-meter rule, stay beyond 2 meters, so that you have a less chance of breathing it in. And of course, the ultimate mechanism of social distancing is stay at home. If at all possible, you stay at home. And that if we can stop the virus jumping from one person to another person, we will defeat it. It has no other way of surviving. It has to go from one person to another. So to summarize, hand hygiene is important. Stay at home if you can. If you do go out, remember the 2-meter rule. And we must defeat this virus. And we can defeat this virus with coordinated action. Everything that you do not believe that your actions are just as an individual. Everything you do can save yourself, can save your family, and can save many other people. Thank you very much. Take care.